Hello, friends. Welcome to Heidi's Colorful Colorado. I'm your host, Heidi, a wife, mom of four, CU Regent, and the founder of Camp Bow Wow and the She Factor. With a passion for keeping the spirit of our state alive and well, I started this podcast to bring the people of Colorado together to celebrate the amazing state we call home. Come along on this journey with me as I travel across our old country roads in my vintage RV, interviewing folks that embody the true spirit of the Rocky Mountains. From the Front Range to the mile-high city to the Wild West of Southern Colorado, we'll celebrate the history, beauty, and Coloradans that make this place the colorful state it is. Each week, you'll meet people trailblazing the way for an even more colorful future for us all, making a huge difference along the way. Are you ready for a Rocky Mountain ride? Let's do this, Colorado. Hello, everyone. Heidi here with Heidi's Colorful Colorado. Gosh, we have a really interesting conversation ahead with Jeff, who is the head of the Mesa County Public Health Department. And you've kind of retained rock star status in Colorado because you have handled this so well. And we were joking about how it's weathered on all of us, but specifically, this has been a tough year and a half for you, Jeff. So tell us a little bit about what's up.
Well, it has been a tough year and a half. We keep hanging in there. I have an awesome team. I have about 120 employees right now because we do have some folks helping us out with contact tracing and things like that. But it's just, we've come together, we're doing it. We're one of very few public health agencies that really handled this all. We did the testing when that was, up and coming. We opened up a place at the fairgrounds, did 1,700 a day. When it was time for vaccinations, we went to our local convention center, and my agency was responsible. We even had to bid to do our vaccinations, but we won the bid, thankfully.
Oh, thank goodness.
So Mesa County Public Health handled that. We're still doing it. So it's been great. We're doing what we're supposed to do as a local public health agency, and we've been a little innovative. We had the 5-star program, and because all along I've felt that the businesses should not suffer, and we have enough data that we could show where the sources of this infection was, and it really wasn't at the businesses. And if it was, we could jump right in there and do those case investigations. So yeah, we from the beginning and really teaming up with our great county commissioners, we've always said there's not a one-size-fits-all solution, and kind of had to go to battle a little bit because when we were in red. With so many cases, we still fought to keep our businesses open. And, the chief of staff for the governor, we talked to her, and I thought, oh my gosh, we're not going to get there. That night, Jill from CDPHE called and said, she wants to see all your information on this. So we got it. We stayed open even in red. And then the governor has come out several times and just said, this makes great sense. And they did implement it statewide as counties chose to participate or not. But we've been open, and that's an early win. We're still we're a year after that basically, and we're still plugging away. But I'm very proud of that effort, and really all the kudos from the governor. I think at one time he said Mesa County is the most open county in the United States right now.
Oh my goodness!
But and we stayed open, and it didn't hurt us, so it was great.
Jeff, tell me a little bit more about the 5-star program.
So the 5-star program just really was a set of guidelines for businesses to operate implementing the best practices to keep people safe. So when we were under a mask mandate, it required masks in these businesses. Employees were masked. We had protocols that we made available for cleaning, for self-service sorts of things. So it was just some very common sense things that our businesses all agreed to participate in because they had to be our partners as well. And then that was a partnership with our local Chamber of Commerce as well. All along I've said public health cannot be the face of this because, boy, before COVID, I would say that most of our residents didn't even really know what a local public health agency did. And So we enlisted the help of our partners to really take on the face of this as well and to work with local businesses. And so it's been a great partnership. Throughout that time, we did have a lot of conversations with other chambers of commerce throughout the state of Colorado, and getting to know those folks. They were all enthusiastic. That was a wonderful process as well.
Okay, so take a step back. Tell us, what does a public health department do?
So that's a good question. So normally at Mesa County Public Health, we have 80 employees and a budget of about $8 million. But what people recognize is we do the restaurant inspections, we do body art facilities. Mesa County does child care licensing as well, and the only other county health department that does that is Denver County. So that's mostly that's a human service thing, but we do that here. We feel a close connection to early childhood education. I have a team of epidemiology experts that serve regionally. We do the WIC program, Women, Infants, and Children. We have a clinic. So we're a full-service local public health agency, but what we find is people know about us only if they use a particular service, so they know that service, but they usually don't know everything else about what we do.
Got it. That makes a lot of sense.
Yeah.
So one of the things we love to dig deep on in this podcast is your personal story. Like, how did you end up being the executive director of a health department?
That's a good question. Something I haven't answered in 20 years, probably. So I have been a local public health director for 19, going on 20 years. I have a bachelor's and a master's degree in community health education, and then I have a PhD from the university. All these are from the University of Nebraska, by the way. And I'm sorry.
Go Buffs.
Yeah, that's right. Okay, I'll take it. So then I did get my PhD in educational psychology, but my dissertation was a public health dissertation. That's sort of where the community health classes slid, was in educational psychology. It's an interesting story of how I started, because I really was into evaluations, data. One of my specialties was data and quantitative and qualitative methods was what I took most of my courses in.
Oh, goodness gracious. I think that was my toughest class in all of college.
Yeah. Sometimes if you're afraid of something, you just take it head on, right?
Yeah, that's true.
So I was working at an insurance company in the research department, and one of my former professors said, they're starting a new health department in Fremont, Nebraska, and they need somebody to contract with to do their initial needs assessment. Mm-hmm. So I said, okay, I'll go pitch it. And so I went out and they hired me. And by the way, so they started that health department back in 2001 as a result of 9/11. Nebraska had to form local public health agencies throughout the state. Only 22 of 93 counties were covered. So in order to receive those federal funds, they went through a process to form all these new local public health agencies, and many of them were regional. So I did this needs assessment for this agency, and they were hiring their first executive director, and somebody said, would you be interested in that? And I said, well, maybe. So I did it. And so I was hired on as the founding director of what was called the Three Rivers Health Department, and it was 3 counties around the Omaha area. Okay. And so the experience was fascinating because, day one, I'm the only person working from my home. So I have to find space and start figuring out what staff do I need to hire. So I built this thing from the ground up, and it was such an awesome experience. And even when I came here, so I came to Mesa County in 2011, and they'll ask the question, you're coming from such a small agency to such a larger agency. I'm coming from 15 employees to 80. And I said, but actually it's not different, because the one person that does epidemiology is my manager of epidemiology at the big agency. So it's the same structure no matter what. My direct reports are all exactly the same. It's just the breadth of what they're doing, the scope, slightly different. So it worked out well, and we've been very successful here at Mesa County Public Health.
Yes,
Boy,
you have.
That was very long.
It's good. It's good. All right, Jeff, what's a big lesson you've learned out of COVID? Is there anything that comes to mind?
Yeah, maybe a lesson. Maybe it's just my approach. No, I won't say that. I've not always known this, but the strategy that I've implemented out of the lesson is that you really have to walk the center. Let's say when we were shut down by governor's orders, there are people that would want us to be shut down always and people that want us wide open. Yeah. And I have to appreciate both of those views, but I have to walk the middle and I have to work really for the people that are more moderate on either side of that. And that does mean that, we aren't in favor of mandates, because as soon as you do that, as soon as you mandate something, you have alienated one half of the residents. And, those folks that want you to mandate it, they don't appreciate that. And I understand that. But as soon as I do that, as soon as I have shut off half of the population, I'm of no value anymore. The community moves past local public health as the leader, and they take it upon themselves to lead this effort. So that has been a great lesson, a great way to move forward with this, and it has allowed us to lead the effort the entire time.
Something that I've noticed is that it's just hard to trust right now. There's so much misinformation, and the government's kind of changed its mind in a lot of ways along the path. And so I think that's caused a lot of the divisiveness. How do we find good information to rely on?
Yeah, that's a tough one. And really in my entire career, when you talk about things like children's vaccinations, there's so much misinformation. I just was talking to somebody yesterday about this. Years ago, I said, people find whatever answer they want on the internet.
Yeah, that's the truth.
And so it just, it just supports what they believe. And that's fine, but boy, with COVID, we just see so much of it. But I don't really want to take anybody on with that. What I've said to folks is that I have a lot of data, and so I'm going to tell you what we know from our own data. I'm not going to throw a research article in your face and say my point's better than yours, because I do appreciate all the points that are out there. All I can do is take a look at what our experience has been with our own data and say, well, for example, reinfections for people that have been infected in the past, we have 90 of them, and it's not very many. So, I do think that people that have been infected have some protection from COVID. We look at the breakthrough vaccinations, and we know that, people who are elderly are at higher risk, and some of them who've been vaccinated have died. But we can tell our own story with our own data, and we don't have to go and get into that battle of which research article is right or wrong.
I love that. That's a great point. And I think as a business person too, that's what we do, right? Mm-hmm. There's all these perceptions about what direction we should take our business or how we should reach customers or spend our resources. Yep. And at the end of the day, you have to look at the data and really just purely make decisions as purely as you can.
That's right.
On that information.
And we could be wrong. I mean, that's the one thing I always make clear is I will be wrong, and I've apologized for moves that I've made. And but I think that's part of the process. I think you build trust that way, which has also been very important to me, is building trust. I want my community to trust me, and I feel like for the most part we're there. Sometimes somebody will say, well, you're holding back information because of something, conspiracy. And I take that opportunity to update that information or put it in a way that they're asking for within a day, so that they go back out, they look at it, and they say, yeah, because I just learned from that person,
right.
And so it's a community effort.
That's great, Jeff. What do you like to do for fun? What do you do outside of your job when you're not handling a pandemic?
Well, I like to camp with our RV. I like to fly fish. I like to mountain bike. Boy, I'll tell you, the COVID 20, maybe I'll call it 20. I would say I've gained 20 pounds with COVID.
You're not alone. We just interviewed Doug over at Enstrom Candy, so yeah. I can't say that I didn't stuff some toffee in my mouth on the way over.
Oh, yeah. But getting away is fun. It's been hard to get away, because I always want to make sure I respond to every email, take every call. So I'm looking forward to that ultimate vacation at some point in time where I can just shut it off. But so far, haven't had that opportunity. But we get to do. I want to go back to an earlier point because I talked about me being from Nebraska and being a Cornhusker. But I want folks to know that, we vacationed in Colorado every year. My dad was a Greyhound bus driver.
No way.
And every February we came skiing. And I tell people this, I would want to be from no other place than the state of Colorado because that's why I'm here. When this job opened up, I told my wife, I'm not going anywhere but Colorado to end my career. And so we came here, and I'm proud to be from Colorado, have been very involved statewide on several governor-appointed committees, and I'm just proud of that work, and I'm proud to be a Coloradan.
That's okay, and you can still root for the Cornhuskers. We'll forgive you.
Yeah.
I'm just teasing.
That's right. I said I learned from my mistakes, right? So, no, I don't want to say that. Yeah.
Cut that.
I love the Cornhuskers, but yeah.
All right, Jeff. So one of the questions we ask folks, which is related, is when people ask you, what do you love about Colorado? Why do you love living here? What do you say?
Well, I love Colorado certainly because there are so many things to do, first off. I love living in Grand Junction because we're isolated, we're our own community. We really come together to solve things. We don't, even in just local public health, I was asked this by the director of the Colorado Department of Higher Education the other day do you share your information with other public health agencies? And I said, no, I really don't, because it becomes almost a battle of, well, that's not the right approach. And I've always told my staff, do things better than what the deliverables are supposed to be proud of it, and let's be the best agency we possibly can. And so I feel like that culture exists in Mesa County as a whole. And we find our own solutions, we go forward, we do it well, and we really don't pay much attention to whatever influence we're going to get from, say, the Front Range.
I think that's smart. It's the under promise, over deliver concept, and Mesa County is a very special place, and you're unique in a lot of ways, and I think you're honoring that by taking that approach.
Yeah, I'm a good fit for Mesa County, but that's why I love it so much. So.
And you've got some great fishing pictures up on the wall.
Yeah.
Where's your favorite fishing place?
Well, I've been on the Gunnison. I floated down the Gunnison last year and caught a lot of fish, maybe 40 plus.
Oh my gosh.
Well, drift boat is the way to go, and then earlier this year in March, I did get to spend the day on the Colorado River in a drift boat, and that was spectacular. So I try to go to different places. We set up our camping trips around, Crystal River, Animas River, so Dolores River. We camp on the Dolores. So we kind of set those up to be in some fishing destinations, and so kind of get the best of both worlds. Get a camp, get a fish.
My dad taught me how to fish on the Newport Beach Pier in Orange County, California. And I don't know if I really caught the fish or if he set it up for me, but I do remember that fish. Yeah. I think I was 4.
Well, that's good. Hopefully it was a big one.
I think in my mind it is. Yeah. Maybe not.
Yeah.
Well, Jeff, thank you so much for joining us and giving us some insights into how things play out here, and some really good advice on how you've played out with COVID. One last question that's really fun that we ask every podcast guest is, what's the most Colorado thing you've ever done?
It's got to be the mountain biking. When I came here, I connected with a group of Coloradans that have been mountain biking. They're my age, but they've been riding mountain bikes forever. And they'll talk about the old Jeep trails that was the only thing available. And I have been everywhere in the state. I've ridden in Steamboat across the Divide. I've ridden up in Vail along Two Elk Creek. I mean, these hidden gem of places. And it's just, I am so grateful for that opportunity to get off the beaten path and to go places that by far most people would not get to go to. And it's just something that I really cherish.
All right. Do you have scars all over your leg? Because I did a few years of mountain biking, and I have a lot of evidence of that.
I have some scars, but the older I get, the more cautious I get too. So anymore, that chance of falling is pretty minimal these days. I'll walk down a hard thing rather than take it on. So
I'm with you.
Yeah.
I'm with you. Well, thanks, Jeff. Thanks for joining us, and keep up the great work. And so just very proud to have you leading such an important effort here.
Thanks, Heidi. And this is a great opportunity. You know, I think it's a privilege to be part of your podcast. It's well known, and so I'm just so fortunate to have been chosen. And thank you for the opportunity.
Thank you for joining us today on Heidi's Colorful Colorado. If you enjoyed this conversation, don't forget to rate, review, and subscribe. And definitely follow me on Instagram to keep up with my latest adventures. In the meantime, happy trails from me, Heidi Ganal.